Today I will explain what is an urostomy and what is the care for it. So a urostomy is an alternative way of eliminating the urine from the body and is a surgical procedure in which the ureters are attached to a small portion of the intestine. On the other end, the segment of the intestine is sealed off and the other end is brought to the abdominal wall and is sutured into place into a stoma. So here I have a makeshift catheter bag. So imagine this is the bag where the urine is collected. So on this part is called the flange, and on the flange there is a small circular site in which it is called the stoma. The stoma is attached into the incision on the part where the body has undergone urostomy. So once this is attached to the patient, there is a tubing called the catheter in which it will be inserted into the stoma, connected to it, and the urine will pass from this tube into the bag. And from this bag, the nurse will empty this bag on a daily basis and empty it through this nozzle, in which the urine will be collected into a graduated cup, and that urine will be measured on daily fluid intake and fluid output, and based on that the nurse can decide whether the patient is hydrated or dehydrated. And from that on, we can also assume that whatever the patient urine color is, we can identify what kind of disease that is present. If the urine is bright yellow and a bit light, then the patient is most often healthy. If the urine consists of blood reddish color, then it is a sign of internal bleeding in the patient's abdomen. So from there we can understand how a urostomy helps to understand what kind of patient disease or condition is. Thank you. Hi, now I will demonstrate how to care for a urostomy bag. So as you can see, this is the urostomy bag where you will collect the urine, and this is the catheter and tubing which is inserted into the patient's stoma. Now, what you need to do is to care for the bag the bag must be put on the patient's side and next to the bed. It could not be put on the patient's center or in between the leg. This is because when we clean and care for it, it is easier to do it by the side of the bed. So next, when we clean the bag, we need to use a paper towel or a wipe to clean the area beside it or the back of the tube whenever we unplug it or we put it back. That is all for caring for urostomy. Thank you.